Welcome to the Agility in Real Life podcast, Take 5 in Real Life. Now your hosts, Mike Studeman, Jeff Lee, and Pat Campbell.
Welcome back to the Agility IRL podcast, Take 5 IRL. I'm Jeff Lee, one of your hosts today, and a partner at Agility IRL.
And another partner at agilityIRL, Pat Campbell. And good to see you again, Jeff.
You as well, Pat. It's been a while since we've recorded one of these, so fun to be doing that again with you. And actually, recently, Mike Studeman and I, our other partner, recorded one talking about Client A and Client B, two different companies in the medical device space, and some things that they are working on to be more agile. If you haven't heard that episode, check out episode number 78 to get that background. Not a prerequisite for this one, however. Pat, we're going to be talking about Client C today.
Client C, I was so excited to hear how Client B has been doing, but we'll focus on Client C if you insist.
Yeah, you'll have to check out that episode. So Client C is similar to Client A and B, where we started with an assessment of their quality management system and came back with some recommendations. And so, Pat, do you want to set the stage on those recommendations for Client C, kind of the big picture of what they're trying to achieve?
Sure, Jeff. So shockingly, in the medical device industry, as Client C is, they also found themselves with a long tail of TAIL of verification, validation, documentation, and submission, and trying to figure out how do we get this product out the door with the same or better level of quality in shorter period of time, which we obviously enjoy trying to help these clients with. And so we took a look at their QMS, probably like you did with at least client A or B, and made a number of recommendations, one of which is definitely doing iterative design, delivery, and reviews and approvals as you go, as opposed to trying to remember it, document it, and review and approve it all at the end, which a lot of companies find themselves stuck in the cycle of doing. So,
Yeah, I think clients I've worked with where that are doing that, right? That's where they end up with that long TAIL, maybe a TALE of woe. They're trying to do that and approve all these like exports documents at the end as opposed to doing it iteratively. So that's interesting way to set the stage here on how they went about doing it in a more iterative way.
Not only that, but I think that might be the title of the podcast, TAIL of woe. But what we did is one of the areas is in the test review and approval area, and in fact took it to the next step of helping to automate the documentation of that through customization of their work management tool, which in this case was Azure DevOps.
All right. So getting out of just the pure process part of it and getting into the tooling to support that.
Yeah, and so the tooling would both automate the capture of the record for later publication, but also help drive the process in terms of ensuring that it was done in a quality fashion by defining what needed to be in that record and also defining who could be selected as approvers to go in and actually select, approve, or reject. And
Okay.
so all the way through to the end as part of the task.
Got it. So moving that approver from, whatever, at the end, this document going through that approval process to actually into Azure DevOps or ADO, putting the official approver of the change record in there.
Yes, and the approvers would actually have labels attached: subject matter expert, author, reviewer one, and reviewer two, so that that would also be identified.
Interesting. So how do you have controls over who does that approval, right? Can anybody on the team just go
They have
and
to be, yeah, no, good question. They have to go through training and acceptance, which is documented as well in terms of who attends the training and who's accepted as an approved recommender, and those are the only people then that can be selected, for example, in the drop downs. So it's very helpful to have that owned by the tool and not just by people trying to keep track of who's who.
Yeah, definitely can see that. So you've automated that testing part. So can you talk about how that works from a flow standpoint in the tool?
Yeah. So in the user story, you would create a test task, and part of that test task, besides in this case automating the test, there then is a review tab in the task. So the task itself is for the automation of the test and review of that test, just to make sure that it's entered correctly. And then the review tab is who is going to actually review the code of the automation and sign off on it. And in this case, it would be four different people associated with that.
All right. So moving that approval much more forward, are they trying to get that done within a sprint? How long are the sprints? Is there an assumption that the approvals are going to take longer?
Yeah, all good questions. They settled on 2-week sprints. The intent is to automate the test and approve it and run it all within the same sprint as the code, which is obviously what we're always trying to get to, and that they have not been able to get to in the past. So this should definitely move them to delivering value that is verified within the same sprint that it started.
Okay. So then what happens at the end? Do you still need to export everything that's in the tool? Is the tool the record itself? How does that work?
The tool is part of the record, but they'll have to go through some final tool validation process to make it part of the design history file. So they will still export the data, and there are integrations with Azure that allow you to do that pretty easily into a report format that'll then be uploaded into their formal documentation management tool.
Mhm. Yeah, one of the concerns that we sometimes hear from our clients is that, well, wait, if we make the tool, in this case ADO, if we validate that and say that is where our part of our design history file, well, that means auditors can go in there and look at the tool. And I think what they don't always realize is auditors can do that anyway, right? Your tools don't have to be part of your design history file for an auditor to say, hey, I want to see what's in there. So that's not a change. It just makes the process more in line with how you actually do work, which is a good thing from the FDA's perspective as well.
Yeah, and demonstrates the designed in quality as opposed to the inspected in quality. But to your point, try saying no to an auditor when you don't want them to look at that data.
Yeah, absolutely. Anything else you want to share with our listeners here about the changes being made?
We're just at the beginning of how we're going to help them do this. So there will probably be more episodes where we'll talk about other things like software change records or software issue open issue records and how we're managing that in an automated fashion.
Gotcha.
Yeah.
Yeah.
So stay
Yeah.
tuned.
So go ahead, Pat.
No, so stay tuned. More to come.
Yeah. For those of you who are struggling with that long TAIL of document approvals and your whole design history file is exported documents, there's a better way to do it. So definitely reach out to us and we're happy to talk through that with you.
We want to make your real lives better.
Absolutely. Well, thanks for joining for this episode.
Bye for now.
Thank you for joining us on this episode of the Take5IRL podcast. If you like it, please go ahead and share it with someone, as well as like and subscribe on your favorite podcast platform. We are available on Apple Podcasts, Spotify, and YouTube. Also, leave us a comment or a suggestion for a future episode. Again, thanks for listening, and we look forward to you joining us next time on the Take 5 IRL podcast.